Are you or someone you love struggling with chronic pain? Do you think you're out of options when it comes to stopping that pain? Well, here to tell us about prolotherapy and how that may be able to help is Dr. Timothy Special. He's a prolotherapist at Caring Medical Center. Good morning. Welcome back,
Good morning.
Doctor.
Yeah, thanks for having me.
So we're going to talk this morning about ankle and foot pain, which I think is very common for people. What is the cause, do you think, a lot of the cause for a lot of the ankle and foot pain that you guys see in your office?
Well, the good thing, Carly, is when you come to a place like Caring Medical, Dr. Hauser and myself, we're going to look at you holistically.
Okay.
We're going to look at you functionally, biomechanically, okay? I'm an osteopathic physician as well as a prior physical therapist, so you may be having problems with your pelvis that may be
would cause
your foot. It may be your knee, it may be your hip. But the ankle and foot is a great, because it's just ligaments and tendons, so we can feel everything with our hands. So you don't always need an MRI or X-ray. Not that we don't use those tools to help us, but we've also got a great app. It's Essential Anatomy 3. And if you look at this strap ligament, this is between the fibula, the outside bone, and the tibia. This is called the syndesmosis. And you hear about high ankle sprains, and they tape them, which might help them. But these are great. There's a great place that we can inject and heal them, improve them very, very quickly, okay, with prolotherapy. And you see the underside. This would be plantar, which is undersurface of the foot, fascia, and this is called the spring ligament. These get stretched, and our ligaments are like rubber bands, and they get stretched. And right above that joint, if we look real quick also, that's called the ankle mortise joint, okay? And some people will even want to have their joints fused, okay? And you'd say, why would you have fusion? And now sometimes you have some wonderful gifted surgeons. I'm grateful, I send them. But most people don't need that. We can treat them with prolotherapy. What does prolotherapy do? Prolotherapy is an irritant. It was developed by Dr. Hackett in the 40s. Starting with natural medicine injection technique using dextrose. And we inject these areas, and the body recognizes an injury and says, aha. And the body will bring down their own natural growth factors to the ankle, foot, wherever you're injured.
Kind of like giving a supercharge,
absolutely,
essentially?
Okay. Whereas cortisone...
which a lot of people do, you know, we're talking about surgery a lot. People go to surgery as an option, but then a lot of people,
there's no long-term studies, Carly. What happens is because of degeneration. And so it's putting a Band-Aid on it temporarily. Don't you want to be fixed? So, and if that doesn't work, we have other options. We can use our own body platelets. And it's called platelet-rich plasma. Heinz Ward, that's what he had. He was the football player with the Pittsburgh Steelers in the Super Bowl. They got him back. They used platelet-rich plasma to improve his condition and get him back on the playing field. And if that doesn't work, we use stem cell prolotherapy now.
Your own stem cells.
Your own stem cells called biocellular prolotherapy. We may get fat from us, or we may get bone marrow from either iliac crest or the tibia. And the neat thing about stem cell is they become anything you want it to be. So if you have a weak cartilage, a ligament, a tendon, it becomes that. These ligaments get stretched. The tendons get stretched. They don't have a lot of good growth factors. So we give them irritants with injection to rebuild them.
Well, and we're talking about the foot and ankle, but this is something that could be done, as we've talked about, in the shoulder or in the hip or in the knee.
Any place in the body. But feet, you have foot pain, you're going to have real problems. You're going to limp. Before you know it, you're going to throw your knee off, your hip off, your back. And then things are progressive. It's not going to go away on its own. We wish it would. Please go away. You wake up, will it? Turf toe, Jack Lambert, football player, another Pittsburgh Steeler. I'm actually a Buffalo Bills fan, sorry. Okay,
You're talking about these Steeler players.
Okay, but they're great athletes, okay? And I think it ended his career, if I'm correctly, turf toe. That can be improved markedly with prolotherapy.
Well, and I think what you guys, you know, for what I gather from you is that you really just want people to know that there is another option to consider before getting another cortisone shot or before going into surgery, God forbid, that'll have you out for several weeks. But why should somebody consider prolotherapy?
Because it's a natural, and we have an 85% success rate, 85 to 90% for the right cases to improve the quality of life.
For the right cases, which I love that you say that, because you will be honest, if someone comes in and they're just too far gone, you'll say, we can't, you know,
so you get a person, they're 50s, 60s, 70s, 80s, you know, they don't want to be an athlete, but they want a good quality of life. Isn't that what it's about, seeing your grandkids, your kids, and you want to get back to work to provide for your family. So that's what you want. That's the nice thing about it. There's no downtime with prolotherapy.
Yeah. So how would somebody find out if they're a good candidate for prolotherapy?
We got a great website, caringmedical.com. They can research it, and from there we have an unbelievable staff. They're very knowledgeable about prolotherapy, give them a call, and then if you feel led, you can see myself or Dr. Hauser. We'll give you an honest opinion, and we'll tell you if we can help or not.
And again, you're looking at the big picture too,
Absolutely.
which I think people need, and they appreciate the extra time that you're willing to spend with them and
Absolutely.
really figure out what's going on.
Right.
Well, we love when you're here. Thank you so much. We appreciate it, Doctor. We look
Carly.
forward to having you back. And certainly for more on Caring Medical Center, all you have to do is go to our website, fox4morningblend.com.
We'll get one last look at your Fox forecast, and then we'll be right back.